I want to speak on gatekeeping because somebody asked me what gatekeeping is. I was actually surprised that they didn't know what gatekeeping was. So I want to speak on gatekeeping in mental health community because that's the community I'm part of. I know that a lot of you who are listening to this right now were familiar or came across gatekeeping at one point in your gender exploration journey. So what is gatekeeping is when it comes to mental health? Gatekeeping is when a mental health provider either puts in front of you obstacles or creates obstacles, kind of hoops that you have to jump through in order to get gender affirming cares that you need. Why do providers put gatekeeping in front of you? Well, in my opinion, there will be two reasons. Reason number one is a benevolent reason, meaning the provider, that's how they were taught. They really think that those gatekeeping obstacles, evaluations it has to take long periods of times, evaluation letters that you need, other things that you may need to go through before you get to surgery that you need, before you get to hormones that you need, before you get to anything else that you may need. Well, they've been really taught that that's how to treat people. That's actually technique. That's how to go about it. In other words, they're doing what they've been told and they think what they're doing is the right way to go about it. It's just simple as that. They're really not meaning any harm to you. They just don't even understand how what they're doing is increasing and prolonging your suffering and struggling. So that's reason number one. It's truly, I would call it ignorance box. Let's just say they're not informed, they're not educated enough, and they're not knowledgeable enough. Box number two. Of gatekeeper mental health providers sometimes can also create obstacles because they have their own personal biases. None of us are perfect. There's a lot of providers out there that have biases. Let me tell you, I'm a mental health provider. I have bias towards certain population of individuals. I'm not going to name them. Yes, I do have a bias. I'm going to be very honest with you. But I know this is my bias. So knowing my bias, I make a very conscious and ethical decision not to work with those individuals because I don't want my bias to affect them. And I don't want to work with them until I resolve my own shit, my own toxic bias about a particular group of individuals. So that's me. Not a lot of providers are going to be like me. There's a lot of providers who work in gender field who do carry internal bias. Maybe they don't believe in gender dysphoria. Maybe they don't believe in treatment for gender dysphoria. Whatever it is, maybe they're not even self-aware about their bias. As a result, they will be putting those gatekeeping in place in order to make it much more difficult for you. Another reason why they may be employing gatekeeping is because they're afraid of liability. Again, this goes back to ignorance. They're not knowledgeable enough. They're not experienced enough. So they're afraid of liability, and as a result, they're really just protecting themselves versus protecting you.